Hello and welcome live from the channel's television global headquarters in Lagos, Nigeria. You're watching Newsroom series. I'm Dominic Iwiwa, and today our focus would be on the Northwest. But before we get into that, let's have a snippet of the top stories making the rounds at the moment. A road crash in Ibadan, the Oyo State capital, has left 5 people dead. According to the FRSC Sector Public Education Officer Mayowa Adeowo, the accident, a 7-vehicle pileup, occurred at about 8 a.m. today around Sonya area of Lagos-Ibadan Expressway and involved articulated vehicles, micro taxis, and private cars. Giving an account of the events that led to the incident, eyewitness accounts say it occurred when a trailer attempting to reverse out of an abandoned filling station along the Lagos-Ibadan Expressway was hit by another trailer coming from behind. The impact triggered a pileup as more trucks rammed into the chaos in quick succession, leaving devastation in its wake. The trailers also plowed into smaller vehicles, including commercial micro taxis and private vehicles. One of the micro cars was completely crushed, killing the driver and 3 passengers. A devastating windstorm has reportedly destroyed some schools in the Funtua senatorial district of Katsina State. The severe windstorm, which occurred in the evening hours of June 22, 2025, caused significant damage to school infrastructure and staff quarters across multiple education institutions in the affected area. In a statement signed by the State Ministry of Basic and Secondary Education, it expressed the government's heartfelt sympathy to the schools, staff, and their families affected by the incident. Although the ministry is actively assessing the extent of the damage and will provide further updates and measures to address the situation, the commissioner in charge of the ministry, Honorable Zainab Musawa, prayed for divine intervention to alleviate the suffering of those affected and assures them of the ministry's support during this challenging time. She further urged schools management to ensure that ongoing school activities continue, stressing the importance of maintaining students' attendance and academic continuity despite adversity. As the rainy season intensifies, the Kaduna State Emergency Management Agency has commenced sensitization of residents, especially those living close to waterways, to vacate such areas. At a stakeholders meeting, the Executive Secretary of the agency, Mr. Usman Mazodo, identified over 700 houses that were built along water channels in Zaria, Sabongari, Kaduna North, Kaduna South, and among others, which he notes contribute to flooding.
Kaduna State is among states listed by the Nigerian Meteorological Agency to experience flooding in this year's rainy season, and in previous times, flood in the state has affected buildings and farmlands across the state. The state government is convening this meeting to mitigate the impact of flood across the state by bringing together key stakeholders from the National Emergency Management Agency, Federal Fire Service, and other relevant agencies to discuss flood preparedness for the 2025 rainy season.
What has happened, or what has occurred in the previous years, not just in 23, 2024, or 2025, but to see how we can put in place a comprehensive guide that will completely put the citizens of Kaduna State in a safe place.
Done with the meeting, the team moves to the field to sensitize the residents on the dangers of dumping refuse in drainage and rivers. In terms of preparedness, the State Emergency Management Agency says it has identified safe areas to relocate vulnerable residents in flood-prone zones and has prepared shelter facilities for immediate response.
There are structures that were already built or erected within waterways, and whenever there is some flooding, people residing in those structures can no longer live due to a lot of reasons. Not to mention issue of diseases, not to mention issue of water destruction, but issue of their life safety and rest.
Although flooding is largely termed a natural disaster, experts say avoidable human factors such as indiscriminate building of houses near waterways and rivers can also worsen the situation.
We have two types of major disaster. We have a natural disaster and we have an human-induced disaster. We understand this flood disaster is a natural disaster. And at the same time, it can be caused by human inducement, carelessness.
These initiatives, which has been championed by the National Emergency Management Agency, to ensure that we prepare in the event of any disaster in order to minimize the impact and reduce the potential impact of those disasters.
As the rains continue, the Kaduna State Emergency Management Agency is urging residents to take responsibility for their lives and properties by relocating to safer areas and avoiding actions that could exacerbate flooding, such as dumping refuse in drainage and rivers.
In what can be described as a bold move to combat water scarcity and improve residents' access to potable water, Sokoto State Governor Ahmed Aliyu has commissioned a water supply project expected to produce 3 million gallons daily in the heart of the metropolis. The water project is one of 6 township water schemes being revived and completed as part of a comprehensive 14 billion naira initiative aimed at delivering 40 million gallons of water per day. The governor said his administration took decisive action immediately to restore water supply and replaced outdated equipment, secured alternative power sources for the water board, which has started manifesting by commissioning this first phase of the water project. Some of the guests at the commissioning include the Sultan of Sokoto, Mahad Abubakar III, who thanks the government for its efforts to provide social amenities for the people. Governor Buni, his counterparts from Yobe State, Governor Mala Buni, says the sole aim of the project is to provide safe drinking water for communities and commends the president for the commitment towards ensuring completion of the project.
These projects are indeed of great significance to the lives of the people. There is no doubt that the water projects have been strategically executed to provide the communities with safe drinking water, to curb water-borne-related diseases, and promote public health. I commend His Excellency for the insight and commitment to providing these dividends of democracy that have direct and great impact to the lives of the citizenry. The investments in this regard are well justified as it has addressed the challenges associated with urbanization and population growth, especially having access to clean and healthy water supply.
The seawater scheme, when completed, are expected to provide 40 million gallons per day. Let me assure you that these are not just a project, but also promise fulfilled, promise to reduce the suffering caused by water scarcity in the state. It was intended to empower our communities and build a more resilient and prosperous Sokoto state.
We are here because this is a community-related program, and whoever has his heart and mind to help our communities, we are fully 100% in support of that person and what he is doing. So, Excellency the Governor, want to congratulate you and thank you for these initiatives, and we expect much more from you in this regard.
A citizens-oriented approach is the best path to human development in Nigeria. This is part of the opinion of the Jigawa State Governor Umar Namadi, who spoke to newsmen following a citizens' engagement in Hadeja local government area of the state. According to him, in the last 2 years of his administration, the people of Jigawa have been taking part in every decision-making process, either directly or indirectly. Our correspondent, Sadiq Ilyasu, reports.
Thousands of supporters trooped to the streets of Hadeja to welcome the Jigawa State Governor, Umar Namadi. as he visited Hadejia local government for a citizens' engagement. Health, education, infrastructure and agriculture are among the key areas of focus for the administration, and some citizens took the opportunity to voice their opinions.
Hadejia General Hospital is now equipped with dialysis machines and other vital healthcare equipment. We are grateful to Governor Umar Namadi. In his 2-year tenure, Governor Namadi has recorded several achievements in so many sectors, especially agriculture and township roads.
The Commissioner for Health, Dr. Abdullahi Kainua, believes the administration is on the right track in terms of health care delivery.
His Excellency, the Governor of Jigawa State, Malam Umar Namadi FCA, as you are aware, is revitalizing in the last 2 years about 181 primary health care centers at the total cost of more than 15 billion naira. At the same time, His Excellency has approved or has employed more than 1,200 primary health care workers that are supposed to work in this kind of environment. And he has also approved additional 1,000 primary health care workers to be employed, which have already selected and discharged their name to the Primary Health Care Development Agency.
The State Governor, Umar Namadi, maintains that a people-oriented budget is key to sustainable human development.
What we are doing now, you can see that after we have given our scorecard, people will now give us their demand in writing. This demand we are collecting from the people is going to serve as an input to our 2020 subsequent years budget, so that at least the budget will reflect the need of the people of Jigawa State. So subsequent budget, as we are going, even though Jigawa State has been a citizen budget always, but I think this is going to change the narratives, because what we are receiving is exactly from the people directly, telling us this is what we want, A, B, C, and D. Therefore, we promise them whatever is in the 2025 budget among what we have submitted, we will implement it. But whatever is outside the 2026 budget, I will assure them that we will put it in the subsequent budget. And this will mean that the budget of Jigawa State government will continue to be a citizen budget and with a more improvement, because this is directly from the people who are collecting.
The Jigawa State government continues to strengthen citizens' participation as a strategic tool for inclusive and effective governance. Abubakar Salihu, Channels Television News.
Welcome back. The Zamfara state government has commenced a large-scale seasonal malaria prevention campaign aimed at reaching over 4 million children across the state. The campaign targets children aged between 3 months and 59 months as part of efforts to reduce the burden of malaria, especially during the peak transmission season. Speaking during the media parley organized to engage and sensitize journalists on the initiative, the Director of Public Health at the Zamfara State Ministry of Health, Dr. Yusuf Abubakar, highlighted the state's commitment to combating malaria-related illnesses and deaths among children. He noted that the SMC campaign is a key intervention strategy and called on parents, caregivers and communities to cooperate with health workers for the success of the exercise. Dr. Abubakar also stressed the importance of accurate media coverage in increasing public awareness and acceptance of the anti-malaria program.
We had a stakeholder engagement meeting where religious leaders, traditional leaders and security personnel, together with other stakeholders, were called. And this plan where, we discussed with them, and all of them agree to, to give their support. I also want you to remember that health is a basic right for everybody. So even in the remote areas, even in the security compromised areas, it is only me and you that cannot go, but people coexist there and they live. And they also require medical and healthcare services. And I assure you, with the community structure we have, with the engagement of traditional rulers and the community resource person we have in the states, we are going to reach all the eligible children that are mapped out for this activity. Everybody in the community know that malaria is actually one of the diseases that is troubling the population. And the malaria services is what is the community are also, requesting. And other services. We have never had any issue of our, team reporting rejection or refusing, the malaria, medicines. We don't have had an issue.
The United Nations Children Fund, in collaboration with Gavi, have announced plans to vaccinate at least 300,000 children over the next 4 years in Kebbi State to protect them against deadly diseases. Dr. Sheikh Humuyin Kabir, UNICEF's country representative in Nigeria, disclosed this during a courtesy visit to the Emir of Arugungu, Alhaji Samila Mohammed Mera, in Arugungu local government area of Kebbi State. Mr. Kabir emphasized the need for traditional leaders to support routine and periodic immunization campaigns, particularly against high-risk diseases such as diphtheria, malaria, tetanus, measles, cholera, and cervical cancer. On June the 19th, Kano State joins the rest of the world to mark 2025 Sickle Cell Day with the theme Global Action, Local Impact, Empowering Communities for Effective Self-Advocacy. To raise awareness about the disease as well as promote the importance of its management, our correspondent Abubakar Salihu reports that Kano has the highest number of children with sickle cell disease in Nigeria.
This medical ward at the Aminu Kano Teaching Hospital is exclusively for patients with sickle cell anemia. Besides exerting considerable financial strains on their families and the healthcare system, due to recurring hospital admissions, patients with sickle cell anemia often experience a lot of pains.
My challenge is just about blood. Yes, but if we did the transfusion, we are taking long time, like 3 months. Yes, we are experiencing pains, our body.
Alhamdulillah, I experienced a lot of pains before coming to the hospital, but I am now better.
His condition puts every member of our family on edge, especially when he experiences crisis at night.
While attributing the cause of sickle cell anemia to some genetic factors, a family physician at the Aminu Kano Teaching Hospital assures that it is preventable through premarital genotype compatibility test of intending couples.
Sickle cell anemia is one of genetic diseases, one of the illnesses that are inherited from parents to their offsprings. Usually it happens when there is some defect in the hemoglobin, which is a compound in their blood. So if there is a defect in that, the father has some defect in his blood, and also the mother has, so the child can have that sickle cell disease, and we call it we call it genotype, which can be either AS or SS. The normal genotype is AA. So if a father has AS and a mother has AS also, or the mother has SS, there is likelihood that their offspring can inherit S from the father and S from the mother, and then giving birth to a child that has a genotype which is SS.
He also calls on government and the general public to show compassion to sufferers of sickle cell anemia by subsidizing their hospital bills.
And then another thing is calling family members and community leaders to support patients living with sickle cell disease. They should avoid stigmatizing them. They should give them all the necessary supports they want. And also at individual levels, we should try as much as we can. Whenever we see a sickle cell patient, we should offer them the necessary assistance we can do. And also at the governmental level, the government should invest in treating sickle cell patients.
Medical experts believe strict adherence to genotype compatibility of intending couples will not only lower the rate of prevalence of sickle cell anemia, but eliminate it completely in the years to come. Abubakar Salihu, Channels Television News.
The Katsina State government has announced plans to embark on massive community sensitization against gender-based violence across the 34 local government areas of the state. The State Commissioner for Women Affairs, Honorable Hadiza Abubakar Yaradua, disclosed this during a two-day gender-based violence strategy and action plan development workshop held in the state capital. The workshop, organized by the Katsina State Ministry of Women Affairs in collaboration with the World Bank, drew participants from various ministries, departments, and agencies, including other major stakeholders in the state. Alhaja Yaradua, who described gender-based violence as a pandemic, observed that stigmatization and injustice remain the major issues surrounding GBV, where perpetrators are not actually convicted. She therefore appealed to the general public to speak up and not be silent on GBV issues.
It's a priority. It's a must. It's something that we cannot keep quiet about anymore. It's almost like a pandemic. You know, there's the issue of stigmatization. There's the issue of, you know, the fear of actually reporting. And then there's injustice where you find the perpetrators are not fully convicted. So it encompasses a lot of issues, and I think it's high time, obviously, we face these issues head on. So with the full support of His Excellency, Malam Diko Umar, who has given us the mandate to charge forward with this, we cannot wait. So this is the first and the beginning of us trying to make a difference and trying to protect our women, children, boys, and the society at large.
And that's where we drop the anchor on this edition of Newsroom series. I'm Dominic Iwiwu. Enjoy the rest of your day.